evening, everyone. Happy weekend. How are you doing today? How has your week been? Happy weekend. Good evening, everyone. Good evening. All right, welcome back to our live Q&A session with Dr. Joy. So, who is joining me this lovely evening as we share to answer the questions that come in bursts and some from the comment section? Who is joining me tonight? All right, so remember, when you come online, don't forget to say hi and tell me where you're watching from. And one good thing I would like you to do for someone else this evening is to make sure you share the video so that others can join and learn. Okay, so who is joining me this lovely evening? How has your week been? Mine has been great. So how has your own been on your own side? So when you come online, don't forget to say hi and tell me where you're watching me from. Like over the week, I posted something, and when I said share, someone in the comment section said, Mama, they will not hear, they will not listen. All right, so I want to say something about that. If you share the video, the most important thing is for you to share the video and for them to watch and learn. Now, it's not for them not to hear. It's not for you to worry about whether they will hear or not, because I think the video, the question was when I shared about putting ginger in your eyes, and yeah, I said share. Good evening, Wabugu. Thank you for joining me this lovely evening. How are you doing? Where are you watching me from? So it's not in your disposition to pressurize anyone to do to whom bread is given or to whom knowledge is given. How do they say? You are expected to do the needful, right? So if someone is saying I will not do, don't worry about that. Just make sure that you spread the right information. That's just all it's about, okay? Gentle Dove, good evening. How are you? Where are you watching me from? So what you do is to share, okay? So don't worry yourself whether they're going to listen or not. Time will come, they will listen, because everyone is using their eye, and I don't think anyone wants to by themselves make their eyes go blind by themselves. All right, so once you come online, say hi, tell me where you're watching from, and please don't forget to share. So I'm saying this to say, don't bother whether they will hear or not, just share, because if we keep giving the right information, definitely the right information will take over the wrong information that has been spreading. So the one thing we should try and do is to share, and forget whether they will do it or not. Just give them the right information. All right, so we are going to start answering the questions. I'm going to start very soon so that we will take it up for the day. You know, it's a live Q&A session, but we don't take so much of the time. Thank you so much, Gentle. Thank you. All right, so please, if you come online, don't forget to tell me where you're watching me from, and thank you for all the sharing. This week we have a lot of people joining us. My name is Dr. Joy Obinna-Jex. I'm an optometrist. For the new followers that just joined, all we do here is to teach you about the eyes. So if you're using the eye, this is the right place to be. And I think everybody should be here, because every one of us is using the eye. All right, so I'm going to start now. So please, once you come online, don't forget to say hi. It's very important. I'm going to start with this. He said, what is the way forward for being diagnosed with glaucoma? What's the treatment? Not going for medical checkups. You guys should bring a lasting solution to this. All right, so I saw this question, and it's an interesting one. When we talk about glaucoma this week, because I posted something, I said if you are diagnosed with glaucoma, try as much as possible to join the community. Very soon we are going to kick off activities in that community, and you wouldn't want to be left out if you are being diagnosed with glaucoma. Please, if you don't have glaucoma, don't join that community. We have eye community, eye family community where you can join. But if you are diagnosed with glaucoma, you need to be there. All right. Good evening, Anebit. Thank you for joining. How are you? Where are you watching me from? All right. So, and this person is saying, what's the way forward when you are being diagnosed with glaucoma, and what's the treatment? Okay, I'm going to say it. First is when you are being diagnosed with glaucoma, what you should do. Happy weekend, Anebit. Okay, so what you should do. If you are being diagnosed with glaucoma, please work closely with your eye doctor. It's very important. You don't need to panic. You don't need to feel bad. You don't need to think that, okay, that's the end of the world, or that you have the fear of being diagnosed with glaucoma, the fear of going blind. This is one of the good evening, Anebe. Thank you for joining me this evening. So this is one of the problem people have, and that problem is they are so scared of losing their sight when they are being diagnosed with glaucoma. If you do the needful, you can still grow old with your eyes without going blind. So that is the way forward. The next question is, what's the treatment? Okay, so the treatment for glaucoma, mostly I used to say if you are being diagnosed with glaucoma, your eye doctor should be able to tell you the type of glaucoma you are diagnosed with and your treatment plan. Now, if your doctor did not tell you your treatment plan, it's very important that you ask what is your treatment plan. So don't panic if your doctor say, oh, you have glaucoma. I've said that before. Now, for your treatment plan, please do not panic about it. Okay? Do not panic about it. Just make sure you ask the needful. Ask your eye doctor, what type of glaucoma are you being diagnosed with, and your treatment plan, in case your doctor did not tell you. Now, I said not going for, okay, what's the treatment? Not going for medical checkups. You guys should bring a lasting solution. Now, this is a very long question, okay? So he said, you guys should bring a lasting solution. Of course, you should know, in the medical field, there are a lot of, things, there are a lot of involvement, there's a lot of new things coming on, okay? So, for now, there is no permanent cure for glaucoma. Okay, so it's a chronic condition. You have to be on your eye drop. Okay, so there is no permanent cure. Anybody that is telling you that there is a permanent cure for glaucoma, please. Oh, okay, sorry. I almost missed the class. You said that, oh, sorry. I was checking our own time here and the time in Nigeria. Sorry about that, please. Okay, so please do not, anybody that is telling you there is a permanent cure, there is something they are going to use to do, and this is why a glaucoma patient will lose their eyes, because they will tell you, oh, don't mind those doctors, they will tell you to go for surgery, some they will even tell you to be using eye drop, but no, don't use it. There is this thing you will put, and once you put it, it will just clear you. Please, this is one of the reasons people go blind from glaucoma. Stick with your eye care professional. If you are not comfortable, I keep saying this every time, you can seek second opinion. All right? If you go to an eye doctor and you are not sure, or you are not 100% satisfied, there is a second opinion for you to go and seek out for, so that you can, compare what you have from the previous doctor and the current daughter you are going with. Okay, so the another person said, my husband has gone blind because of this deadly disease. All right. Yeah, Aderenke, thank you, good evening, thank you for joining me this evening. He said, my husband has gone blind from this deadly disease. Oh, it's not really the people that are experiencing this, they know what they're experiencing. So when we talk about you taking this serious, we know what we have seen. Now this person is just put this in the comment section because of this deadly disease, and I advised her, please make sure your kids are on regular annual eye test, because this is the only way you can dictate that you have glaucoma. If you're waiting for it to start giving you blurry vision, if you watch all the videos that I did this week, one of the things I said, if you're waiting for glaucoma to start giving you sign, yeah, there are some that will give you sign, painful, red eye, and all the rest. But as someone that has glaucoma in their family, okay, as someone that has glaucoma in their family, don't wait for you to have these signs. Have regular annual eye tests. Okay, and then I said, please extend the live streaming. Okay, but I will. Please tell anyone that needs to be here. If you are supposed to be here, please tell them to come online, because it's a question I can't go back to. The question I've answered before. Just try as much as possible. They should try and join now so that they can as well learn. Okay, so please, if you have someone in the family, in fact, one of the risk factors for glaucoma is family history of glaucoma. Like over the time, there are several people that they don't have any issue already, but because there's someone diagnosed of glaucoma, they usually come for an eye test. And other people too that have been diagnosed, like this lady now that said, my husband has gone blind because of this deadly disease. Okay, so what I do, I make sure that I advise all my patients that have been diagnosed with glaucoma, please take it home. Go back home, inform the family, inform the kids, inform everyone. I have been diagnosed with glaucoma. Oh, thank you, sir. We are live, doctor. Thank you so much for joining me this lovely evening. Okay, so make sure that you inform everyone that is supposed to know, especially people from the family. Okay, like I've also advised her, make sure that your kids are on annual eye test. This is the only way you can, work on your glaucoma and make sure that it's okay. So, and also this is why I'm creating this family called a glaucoma community, so that people with glaucoma, you come together. There are professionals that is going to be in that community to assist you. You hear stories from other people, okay, that will also encourage you, because people think there is one mistake that people usually think about the eyes, and that mistake is about the eyes. It won't kill me. Says who? Okay, it's about the eyes, but it won't kill you. When I hear comments like this, I laugh. I say it won't kill you. Okay, so I have someone that died. It's not because of this glaucoma. Okay, and then several of them that have the one that have been diagnosed with glaucoma, she said, instead of me to go blind, I would rather kill myself. There are some psychological issues that come with being diagnosed with glaucoma. I'm writing a book on glaucoma, so you can see there is no glaucoma patient that I've ever talked with that have not said about their psychological issue when they were diagnosed with glaucoma, especially those that already have people that are blind in the family already. You will notice that there is this, once they say you have glaucoma, there is this psychological impact that it drops on them. And this is why I am doing what I'm doing and creating that community. Okay, I'm taking time to answer this glaucoma thing because a lot of people think it's a joke. A lot of people think it's not real. A lot of people think that is not. I have young people. I'm not just talking about elderly people now. I have young people that are blind from glaucoma. that is not even up to 30. I mean 30 years old. So it's not something you should joke with, okay? So if you have not watched the videos, all my interviews on glaucoma, please try and make sure that you watch them so that you understand it better. Okay, so let's move forward. Thank you everyone that is joining. Please, when you come online, just say hi. All right, okay. So let me take this one. It said, I saw online. When I saw this question, I started laughing. Because there is a person too that came before that video I posted, and when I saw this one, I was amazed. I was laughing. Okay, so let me read the question. All right, Comfort Thompson. Comfort Thompson, thank you. Good evening. Thank you for joining me this lovely evening. Okay, said I saw online where a woman said she's not using glasses at her age and she's old because of ginger. She used to put ginger in her eyes. So I tried it, but it was so painful. She said, no pain, no gain. How true is this? Okay, so sorry I'm laughing though, but when I saw the question, I was like, which one? No pain, no gain. Okay. Please. My advice to this person, I've answered this person is coming from TikTok, all right? So if you're not following me on TikTok, please make sure you go to TikTok, look for You and Your Eyes with Dr. Joy, and make sure you are following me there as well. So he said there is a woman that is telling them to put ginger in your eyes. You know, this week, I posted, Comfort is laughing, but then it's so laughable. I posted, I said, please, do not put ginger in your eyes. You know how hot ginger is, okay? And when you put it, it can burn your cornea, all right? And she said, a woman asked them, because the woman is old, and the woman is telling them, yes, I cannot use glasses because I'm putting ginger in my eyes. That is a fallacy. It's never true, because I can tell you for free, she should come, let me test her myself and let's compare. Okay, but what I'm trying to say is, and the person is saying no pain, no gain. So the ginger has to burn your cornea so that you can gain. No. Please do not practice that. For no reason should you put ginger in your eyes. You grate it or grind it and then you put in your eyes. Please, let's learn better. When you are talking about maybe not using glasses, if you are at the age of late 30s to 40, there is what we call presbyopia, you know, whereby you start finding it difficult to read tiny print, all right? Now, that is a physiological change that comes with age. Most of the changes in our body that comes with age, we don't even change them. Now, why do we think that we can change the one in the eyes? You know, we should be thinking when people are telling us this. Okay, so you have to think. If you say I cannot read tiny print, just learn it. I've posted the video here. If you need it, I can still repost it again. Once you find it difficult to read tiny print and you are in your late 30s, 40s, just note that is a physiological change that is coming as a result of age. Not because if you put it's not a bad eyes. It's not because your eyes are so bad now, that's why you can't read tiny print. It's a change that comes with age. That 80% of the people who experience it. The only people that will find out that can still read at that age are people that develop nearsighted, especially early. Like you can't see far. But once they keep their book like this, they can see. But when you test them in the practice and put their correction, you will notice that they can't read because their correction is there. And you see them taking off their glasses. So even with their their minus lenses, we still include the reading. So you don't need to be taking your glasses up and down. All right, so please don't let someone deceive you. Don't let someone tell you things that are not right. If someone in their 80s is still not using glasses, no, one of the things I ask them, have you tested your eyes? Because it's possible you have what you are nearsighted, or you are myopic, or if you even have a type of cataract that can even make you not to struggle to read. And then another thing I ask is, what kind of work do you do? Because sometimes the kind of work you do has also to do with it. All right, so please don't practice this. I beg of you, do not put ginger in your eyes. Don't use your hand by yourself to spoil your eyes by saying no pain, no gain. It's a lie. This one, there is pain and there is no gain in it. All right. Okay, so let's go to another question. Who is enjoying this our live session this evening? I hope you are learning. All right. The answers of this live session, answering all these questions, is because if I just answer them in their inbox, all right, you find out that you will not learn. Okay, but once I come online like this and answer the questions openly, you see, everyone will also learn. So that's why you have to share and invite others. Ihechi Precious, good evening. How are you? Okay, so let's go to the next question. He said, I did refraction and I was given a new lens. I have been using glasses for some time now. Excuse me. Okay, excuse me. Okay, so let me start again. Okay, he said, I did refraction and I was given a new lens. I have been using glasses for some time now. Oh, sorry. Okay. Okay, let me start again. All right. Thank you. Thank you. Sorry, let me get some water. All right, so let's start. All right. Okay, so I did refraction and I was given a new lens. I've been using glasses for some time now. So I had a refraction done and eye drops were recommended, but I'm not yet okay. All right, thank you. Thank you. All right, this person initially asked about itching, which I answered last week live Q&A session, and also the video that I did on itching. So I asked, so she still sent in this question. First thing is, if you have gone for an eye test and you are being given an eye drop, one thing I want you to know is eye drops is not cannot work like magic. It's a gradual process. That's number one thing I want you to know. You can be given an eye drop now. You don't expect to use the eye drop now and everything like itching, tearing, everything will stop now. It doesn't work that way. That's why sometimes we give you drugs that can take you up to a month. Sometimes we give you the one that can take you up to 2 weeks, 3 weeks. It all depends. Now, if you have gotten an eye drop and you've used it, for how long have you used the drop? If you have used this eye drop for a week, 2 weeks, and you are still not feeling okay, now the right thing for you to do is to go back to your doctor and say, I have used this drop, but I'm not yet feeling okay. All right? I have used this drop and I'm not yet feeling okay. Now, because one of the things that patients do, now that she has wrote this thing, says she even eye drop were recommended and she's not, and she couldn't still not getting or not comfortable, she will jump to another place. So before seeking a second opinion, please try and go back to your doctor and report that you are not comfortable yet. If the eye is teary, you say, okay, your initial complaint was itching and teary eyes. If the itching has stopped, you say, okay, this one has stopped, but I'm still experiencing teary eyes. But if the two is still there, go back and say, I have used this drop. This one, I'm still having itchy eyes and teary eyes. They are still there and I'm not comfortable. Okay, so that the doctor could maybe change the type of eye drop you have been given, or the doctor can, add more eye drop to what you are using. Okay, Ginger, let me say, I think ginger was more. They could have used pepper. Maybe that's the next one we are going to, because even someone in the comment section said, it's not only ginger, even bitter cola. Please, guys, let's do better. That's why we are doing this, so that people can learn better. How can you ask someone to put ginger in their eyes that is very hot as pepper? For my Namibian people that will say chili, for as hot as chili, and you're putting in your eyes, it's terrible. Okay, so like what I was saying, please, if you have seen an eye doctor, make sure that you go back to report your go back whether you are asked to come back for a follow-up visit or not. As long as you've gone and you are not comfortable, please go back if you are not comfortable at all. All right, because going to a second opinion when you've not gone back to report whether you are okay or not is not good. Okay, so let's go to the next question. It said, why would they be using ginger on the eye? I don't know. They're using it to, the lady say it's for bad eyes, and I asked her one question which she has not replied, which she has not said anything since in the comment section. I asked her, what type of bad eyes is it treating? Because some will say, in order for you to read tiny print, all of these things are not right, okay? There are things that people keep saying, but they don't, it's not right. It's not the right thing to do. You can harm yourself in the name of trying to do it. All right, so let's go to the next question. This night I will just answer, because I've seen one question in the comment section, in the comment here. I will take the question. If you have one question, I will take two more questions after the ones I have here before we'll call it a day. All right, so this is say, how about projector? I think this question is coming from the video I posted today about kids using screen in excess. Why they shouldn't use screen in excess. If you are exposing your kids to watching the phone, laptop, PC, television for a long time. If you have not seen that video, please make sure you watch the video and share, especially these days that the phone and laptop, computers, they are doing nanny job. Please share that video so that others can learn. Now this person is asking about how about projector. Now when I did the video, if you watch that video, one of the things I said is what we discourage is excessive near work. Most times when you are using a projector, is either you are learning, which is for a limited time. No kid or no adult stays on a projector watching for a very long time. And what we are discouraging you from doing is staying, especially the kids, for a very long time. So if you are learning with your projector, fine and good. It's most times I have seen is 2 hours, 3 hours at most. I've not seen from morning till night watching on a projector. Even if you go to a cinema, it's maybe 30 or 1 hour at most, 1 hour, So for projector, it's okay. You can watch your projector, but if you think you want to do more to protect your eyes, get your blue control lenses. I've done a video here about the right blue control lens to get. Yeah, I've done a video, the right one, because most these days vendors are all over social media selling blue light lenses, because they say once it's shining blue, it is. No, I've done a video here to give you the right blue control you should get, and don't just go and buy because it's a blue control. You get it from the professionals that will give you the right one of projector. So if you're going to be using projector and it's like for a whole week, a whole month, you're going to be learning on the projector, I would advise you to get a blue control lens that will help your eyes. Okay, I guess that's okay. So that's all the questions that I have tonight, but I'm going to answer. I have seen a question here, so I'm going to answer that question so that others can also. But if you have questions, like I said, I want to take 2 questions from the comment section now, and we'll call it a day. All right, now let me answer the first one that I'm seeing here from Anebe to Dome. Say, my eyes always itch me. What kind of drug can I use? Okay, thank God it's coming from Anebet. Anebet is a follower that has been here for a long time, and one of my highest sharers. You know, once a video drop, Anebet will always share. Thank you for that. Now, Anebet, now one thing I want you to know, I did a video last week about itchy eyes, all right? And I said itchy eyes is as a result of allergy. If your eyes are itchy, it's possible that it's something you are allergic to. Another thing that can make your eyes to be itchy is dry eyes. If your eyes are dry, definitely you have itchy eyes once in a while, okay? So what you should do is, you know, normally I don't prescribe drugs for people without testing. I don't like doing it. It's not as if I can't prescribe drug for you, but I don't like doing it because if I prescribe an eye drop for you now, and that eye drop it's for instance is for itching, okay, you get the itching. So what if there are other things in the eye that needs to be handled? You know, I've not done a complete thing for you because I've given you one. Then how about the others? All right. So first is, please, one of the things I want you to do is try and get your eye tested so that we can know that it's only itchy. So try to find out what you are allergic to, because if your eyes are dry as well, you need not just for itching, you also need for a drop to lubricate your eyes. And another thing you should do, like I've said it before here, if you're always on the computer or phone, the ways you can help your eyes. First is make sure that you lubricate your eyes. Also blink. Take out some time to rest. Look for something that is 20 meters for 20 seconds. They are simple things to do. Hydrate yourself. Drink a lot of water so that it can help your eyes to be lubricated, because some of us can stay on the screen for 1 hour, 2 hours without getting even a glass of water to drink. And remember that the quantity of water you should drink for a whole day is 2 liters of water. So if you're not drinking up to 2 liters, you're not drinking enough water. So go back and measure 2 liters of water. Get something that you use. I have something that I use to measure my own 2 liters of water in a day. So I make sure that one of the things I do is that I make sure that I finish it. Whether I'm thirsty or not, I will keep drinking. So it's going to go a long way to help. Now, I'm going to also answer Edidion's question. Edidion Solomon. This is also another follower that has been here, sharing, inviting people. Thank you so much for that. He said, thank you, Ma, for answering my question, because I want to get projector for my kids so that my phone can, okay, I'm not seeing the other one. So, okay, so let me answer the question. He said, they struggle with my phone with me because I don't allow them to have access to it, even as I'm typing in this conversation. You know, I'm a mother too, all right? I understand fully what you are saying. One of the things that will help you is try to create activities for the kids and get toys for them. like building blocks. If you can buy building blocks, it helps them. And building block is very good for playing. All right, it's is educational as well. If you go to schools or playgrounds, you will get a building block. So try and buy a building block for them, so you can always drop the building block for them to be building something with while you are busy. Because if you are always if they are on the phone all the time, like I've said in that video, it's not good for their eyes. It's not even good for them in terms of educational stuff. But I'm talking about their eyes now, because if you have more kids that are developing nearsighted when their parents and nobody is nearsighted, and then they're developing nearsighted because of so much exposure to screen, so it should be monitored properly. How many a kid can only be on the screen for 2 hours a day, and that is all. It shouldn't be beyond 2 hours. Any other thing beyond 2 hours is excess. Okay, so if a kid is on the screen beyond 2 hours, is already excessive usage of screen. All right, so what you should do, instead of struggling with them, create activities for them, get a building block for them, so that they can, they will not, even if you don't buy the very big one, I think they have a smaller pack one they can use to be building things, so that they have what to do. Because kids, excuse me, kids always want activities. They wouldn't want to stay one place. They used to say anytime they are quiet, please go and watch what is happening around them. They are either doing something that will make you scream or something. So please, what you do, get something and plan an activity for them, so that they can also engage in other things, not struggling with you with the phone. All right, okay. Okay, they have building blog, and once I play video with my phone, they abandon you to join you. Oh my word. Okay, so what you have to do, you have to find a way, because if they are struggling with the phone and you give them phone for over 2 hours, it's not good for their eyes. All right, it's not good at all. So what you do is create an activity around them. Create an activity, give them what to do, give them what to write, give them what to draw, so that it will help them to do something else. And then another thing is, once you see they are too much asking for the phone, you yourself, you have to drop the phone for some time and be with them before you can go back to the phone. All right, it has been a lovely evening, right? All the questions for this night has been answered. I'm glad about that. So next week Saturday is another time for live Q&A session. If you are enjoying the live Q&A session, if you are learning, please don't forget to invite others. Don't forget to share the videos, so that others can learn as well. Okay, I didn't say I will buy headsets for peace to reign. Yeah, if it will help, why not? So that peace will reign in the house and reign for them as well. All right, so please make sure that if you have any question about the eyes, you can ask in the comment section. You can ask in boss. Please, for the people asking in boss, because someone said, you have not answered my question for a long time. What I do, I'm working, I have a lot of things that I'm doing. I may not answer your question as you are dropping it immediately. Okay, so what I do is, at my time of looking at your question, I will go back and look, answer, I will answer, and then still come here to explain more, because when you are typing, you may not type it whole, but when you are explaining, talking, it's much better. All right, so when you ask question, please don't ask question and go. All right, sorry for the short break because of network. So I'm just concluding. Okay, so please try as much as possible to drop your question. If you're comfortable dropping inbox, fine and good. If you're comfortable dropping in the comment section, the videos that I post, if you have any question from any of the videos, please try as much as possible to ask the question. You can ask, like I said before, in the comments. You can ask inbox. Definitely I will see them to answer. Thank you, Edijon. Thank you so much for joining me. Thank you everyone for joining me this lovely evening. Please make sure that you are following this page, and if you are on TikTok, look for You and Your Eyes with Dr. Joy. Join me on TikTok. If you are in Instagram, I'm also there, You and Your Eyes with Dr. Joy. Please don't forget to subscribe to my YouTube channel. If you have not subscribed yet, please make sure that you will go, as we are dropping now, go and look for You and Your Eyes with Dr. Joy so that you can subscribe to my YouTube channel. All we do here is all about the eyes. Thank you. Enjoy your lovely night rest. Edijon, more wisdom and grace to you. Thank you so much. Thank you. Thank you. Bye for now.